The challenges that lie ahead for India as the COVID-ravaged nation continues to report record levels of infections and deaths.
400,000 cases a day, 3,500 people losing their lives in a day. Heartbreaking photos of mass funeral pyres. Grieving family dressed in protective suits performing last rites of their loved ones.
With surging new cases and deaths, India is facing an unfolding coronavirus catastrophe.
What on earth is happening in India? In April, India's COVID-19 cases rose exponentially, putting the country's already inept public healthcare infrastructure on its knees. Every day, cases in the hundreds of thousands are being recorded, specifically in Maharashtra and Kerala, the worst hit states. The situation is dire across the country, with many people asking, how did the pandemic, once contained, go so terribly out of control? First of all, it is important to note that India is a country of 1.3 billion people, many of whom live in densely populated cities. It is very common in India for 15 people to share a home, apartment, or makeshift house. This vulnerability provides a breathing ground for COVID-19 to spread like wildfire. In the wake of this surge, the response from the federal government in India has been slow and incompetent in its ability to effectively curtail the pandemic spread, whilst also cater to those already sick and dying. A shortage of oxygen, ventilators, and hospital beds are leaving many people uncared for, lacking the necessary equipment needed to survive. These unnecessary deaths are putting immense public pressure on the nation's Prime Minister Narendra Modi to address the desperate calls of his people. While the necessary health equipment is pouring in from the UK, the US, Australia, as well as several other nations, it is unclear whether this equipment is being quickly distributed amongst the masses locally. In a moment of such tragedy, we mustn't simply look on and ponder about India's plight, but rather examine the context and offer credible solutions to mitigate the pandemic's disastrous spree across the country. Last March, when the repercussions of COVID-19 were being first experienced in the US and Europe, India was actually one of the first countries to introduce a strict nationwide lockdown to prevent a serious outbreak domestically. The policy was widely perceived as draconian and ineffectively implemented, with many local public officials questioning what could and could not be open. Regardless, the restrictions proved relatively effective in curtailing the number of COVID cases in India. On average, new daily cases ranged roughly between 50,000 to 100,000 people, peaking in mid-September 2020, but then decreasing to a low of 8,000 new cases per day in February of this year. Regardless of whether the number be 100,000 or 8,000, these numbers in terms of cases are relatively low for a nation that has a population of 1.3 billion people. Given India's initial success, Modi publicly declared that India successfully defeated the virus, or in other words, conquered it. His government relaxed numerous social distancing measures and permitted mass political rallies, religious gatherings for various Hindu festivals, and crowded pilgrimages where up to 2.5 million people entered the Ganges River. Furthermore, Modi and his allies in India's largely state-controlled media pushed numerous falsehoods that Indians were somehow immune from the virus due to some biological and religious features specific to their peoples and country. These bogus reports fueled an attitude of ignorance against COVID-19. The government and public lowered their guard and dropped the precautions that were once taken to curtail the spread of the pandemic in the first place. All the while, as earlier alluded to, it is important to note that while India does have a dynamic, vibrant private sector, its public sector is often riddled with corruption and mismanagement. Public services like healthcare are underfunded, understaffed, and lack access to the latest medical technologies. While India's healthcare system has been historically designed to cater to people at the village level, small urban centres, and at the tertiary care level for specialised treatment, much of the focus in recent decades has been on the country's for-profit tertiary hospitals. At these hospitals, it is common for doctors to fill their pockets with high salaries, often attributed to unnecessary surgeries or overcharging patients. Over the years, government insight has been inadequate primarily due to its focus on providing food for the poor as well as giving them access to clean drinking water. Healthcare is often seen as a service used by rich people in India. As a result, most of India's poor, in fact 90% of them, are uninsured. The government has also prioritized medical tourism as another way to boost the profitability of the country's healthcare system. A now $3 billion industry, over the years, subsequent Indian governments have actively promoted and invited people from Western countries to come to India to seek dental, cosmetic, and other surgeries at cheap prices. As a result, much of India's public healthcare services, those specifically designed to cater to the masses, have been subject to decades of neglect. Therefore, it is, in my view, not surprising to witness the systematic collapse of India's public healthcare system at the heart of this public health catastrophe. Let's face it, they were simply unprepared. While this is certainly a grim situation, let's now have a look at what can be done to resolve the problem. After reading extensively, I have come to the conclusion that there are three key strategies that need to be implemented. Firstly, it is important to note that none of these particular strategies include another nationwide lockdown. Given population density, a lockdown would be pointless simply because the virus is already widely spread across the country. Therefore, what is needed is universal mask wearing, coupled with rapid antigen tests and the isolation of positive cases in COVID designated buildings, as described by an op-ed published in the Washington Post. Hi-fi masks are categorized by high-grade filtration and a firm fit around the mouth and nose. In doing so, it provides added protection against COVID-19's respiratory particles, which are released when an infected person coughs, sneezes, talks, or laughs. Examples of such masks include KF94s from South Korea, KN95s from China, and FFP2s from Europe. If obtained or domestically produced, case numbers should decrease substantially. I would expect this decrease to be far greater than any decrease associated with the mere use of surgical masks. Failing this strategy, the government could produce mask fitters which strengthen the hold of surgical masks on the mouth and nose. And if this does not work, then the government could openly encourage people to wear cloth masks over the surgical masks to add double protection against COVID-19's respiratory particles. The government can make use of India's national food supplementation system, where an official is assigned to provide food rations to people in their respective village, to also provide mask fitters, hi-fi masks, or cloth masks where needed. The government must also use rapid antigen tests coupled with polymerase chain reaction tests to track down those who are most contagious in society. Antigen tests generally generate an accurate test result, especially if the person is highly infectious. However, some of these tests might yield false positives or false negatives due to how rapidly the result is generated. To eliminate these inaccuracies, PCR tests must accompany antigen testing because they are more accurate. Since PCR tests cannot be scaled widely, they should only be used when an antigen test generates a false positive or false negative result. Lastly, the federal government must work with state governments to designate certain spaces, or in other words, buildings, where COVID-19 infected persons can temporarily reside. In doing so, these people can be isolated from the general population, decreasing the risk of the virus spreading from infected to non-infected people. These designated spaces somewhat mirror the concept of hotel quarantine, where inbound travelers are often told to reside in hotels when they arrive, specifically in Western nations, where hotel quarantine appears to be more prominent. For this to work, effective coordination and communication is vital. Therefore, through a combination of universal mask wearing, PCR and antigen tests, as well as COVID designated zones, the federal government should be able to effectively reduce the exploding COVID-19 infection rate in India. However, these strategies can only be effectively implemented provided that the federal government does its role in orchestrating the relief operation. Given India's past vulnerabilities to corruption, public healthcare neglect, and the absence of a free media, it would be interesting to see whether Modi can resolve a present disaster attributed to historical failings.